What a beautiful story we've just heard from the Koza family. And we'd like to thank them for actually opening their hearts and taking us through their journey of infertility. Infertility is a very broad spectrum, and it is associated with many different causes. As we've heard from them, their biggest struggle was the fallopian tubes and how they went through ectopic pregnancies and how they also even ended up with multiple pregnancy losses or miscarriages. So, again, infertility can also be caused by issues that are affecting the ovaries. Many conditions like polycystic ovarian syndrome and primary ovarian insufficiency, where the eggs actually run out before the age of 40. So these are the conditions that could affect fertility. So for the Koza family, what we found was that the fallopian tubes were actually highly inflamed. That's when I explained to them that the fluid that is found in the fallopian tube is actually causing a very toxic environment for the babies to grow. So it could have been the cause of their multiple pregnancy losses or the miscarriages that they've had. So we had to disconnect the fallopian tubes from the womb itself. And that also was a very difficult decision for them to make. After having made that decision, they were then taken to theater where we had to separate the tubes from the womb. The tubes were actually quite distorted, and the anatomy was of the whole entire tube that was left behind was affected. At times, we just clamp the tubes and leave them inside, but in the long run, for some patients, you find that there's fluid collection that causes severe pain and pelvic pain as time goes. We then do what we call a salpingostomy to actually open a small hole for the tubes to drain. But for others, even that would not make much of a difference. So unfortunately for the Koza family, both the tubes that were remaining had to be removed, and they go through IVF afresh. Their IVF cycle also had the challenge of the fact that Gloria at that time was already 39 years old. So remember, as age increases, the quality and the quantity or number of the eggs actually decreases. So that was another challenge that we had, which we call advanced maternal age. With what we had, we managed to go through in vitro fertilization with them. We harvested the eggs that we found, were able to get sperm from the husband, we fertilized, and were able to grow the babies in the laboratory. On day 5, as she says, the babies were transferred back, and it was a really not much eventful IVF process, which led to a successful pregnancy and delivery of their healthy baby Una, which we are really grateful for. So there are also other factors like things that could affect the womb itself. We're talking of conditions like fibroids, conditions like endometriosis, adenomyosis, and polyps that fertility specialists actually look out for and treat if such conditions are found before you actually either go through IVF or they treat, and you can also even go through even a natural pregnancy depending on what exactly is found during the course of your investigation. On the male front, we have real difficulties when it comes to male support or involvement. I will really like to beg of our male society, our brothers, please do come forth for further investigations if you are struggling to conceive as a couple. It really does take two to tango. Sometimes you may find that men find themselves able to hold an erection and have an ejaculation and then take it for granted that there is sperm present, therefore the partner should be falling pregnant. Let's put that ejaculate under a microscope. Many a times we find that in the semen there is not even sperm that is present, but you cannot tell that through your naked eye. All you see is fluid. So the testicles need to be producing sperm. that then comes out with the rest of the fluid as ejaculate. So we do need the men to come in and get their sperm tested as well. And that's all we ask for. That's all that we do. I do understand that the process of harvesting or getting the sperm itself can be a bit uncomfortable. But unfortunately, that's the one route that we have to actually get the sperm. And that's mostly through masturbation. Sometimes we have special condoms that we give men for them to be able to have sexual intercourse with their partners and then transfer the sperm within that special condom, and it should be in the laboratory within at least an hour of production. So some couples are more comfortable with that than the process of masturbation. But whichever one works for you, as long as we are able to retrieve any sperm sample, we are able to test it and then give a diagnosis. And whatever the diagnosis, be it absent sperm or low sperm quality or quantity, we are able to give you options from there as to what can be done. It really helps to find a couple going through the process together. The support that they get from each other is surmountable. So, my advice to all the couples or any individual that is actually struggling with conception is to come forward, especially with women. Remember, once a woman is beyond the age of 35, then quality and quantity of the eggs that we get becomes a problem. If you're still single, we do recommend that you come forward and maybe we can just get you an insurance for your eggs. We can take out your eggs and freeze them for the right time, for when you are ready or when a partner is available that you would like to start a family with. And you don't have to go through regrets of having aged over time. So when couples come through who are struggling with infertility, we start off by taking their whole history. If ever they've fallen pregnant before, are there any babies that are alive and so on, and their medical conditions and the drugs and all of that, and social status also does play a role. So then we go through the investigations. What could be wrong? Starting from hormonal imbalances, checking the hormones, are there hormones that are affecting ovulation and so on and so forth. Then we look at doing a sonar on the woman. Are there fibroids? Are there diseases or cysts or anything that could be affecting or obstructing pregnancy? And then we go on to check the male as well to see if there is presence of sperm and the quality and the quantity of the sperm that is present. Then, depending on the findings, we like to treat a condition that's already existing, be it polycystic ovarian syndrome or endometriosis or fibroids, etc. Now, there are different interventions that we can have. For some couples, it's a simple thing like timing of ovulation, because we've tested their fallopian tubes and the tubes are fine and the semen is fine. So we just assist them by natural conception to say when to time for ovulation, when to time for intercourse, and they fall pregnant naturally. For other couples, a little further intervention is needed, where we then tell them, okay, we'll give you some medication to help you with the ovulation. So a woman then takes medication mostly from day 3 to day 5 of the menstrual period, and then we are able to observe if the egg is growing and if the lady is actually ovulating by doing also some blood tests to assist us with that. Then we help them to either time for sexual activity during the time of ovulation, or we do a procedure that is called intrauterine insemination, where we help the sperm just swim up a short distance into the womb by me then inserting the semen into the womb through the vaginal canal, just through the woman's cervix. So we just give the sperm a bit of a head start. The rest of the work, shellering and all of that, they have to do on their own. And insemination is actually a blind procedure, so we cannot tell whether fertilization actually took place or what is actually happening in that fallopian tube. We only do a pregnancy test 2 weeks after the procedure to check whether the procedure has been successful or not. And this just speeds up the process or gives us a head start with a success rate of plus minus 12%. Now, this is way cheaper when compared to in vitro fertilization, as the intervention is quite minimal.